So good morning and welcome to our 2020 Healthier Together Health Summit via Zoom. Some people were wondering, are we going to have a health summit in the middle of a pandemic? And I would say that's precisely when you should have a health summit, is in the middle of a pandemic. If you can't do it then I'm wondering what we're trying to achieve together. My name is Rob Dyer. I'm co-chair of the Healthier Together Council Partners, and I'm your host for the day to get us going, and then I'll be passing those duties on to other folks as we move through our agenda. We are going to be on time. We're going to finish by 10. In fact, we might even get you out 5 minutes early. So what will you do with all that time? That's up to you. But we're going to be running through a few things. I want to run you through some logistics because I realize not everyone who's on has done a lot of Zoom. Some of you are like, I live in Zoom. I'm not even sure what my address is anymore because I spend so much time in Zoom. But for those of you who aren't as familiar, if you're on some type of PC or computer, at the top right-hand corner of your screen, it'll say View. And I want to encourage you to click on that and select Speaker View. And so that whoever's speaking will show up much bigger on your screen. For those of you who are on more mobile devices, it's swiping right and left that toggles it between having a bigger view with multiple folks on your screen versus seeing just the main speaker. So again, I want to encourage you to go ahead and put it in speaker view because that's how you're going to really get the best seat in the house, so to speak, as people are talking. We're going to go ahead and assume that people are fairly well behaved. And so at times we're going to go ahead and mute everyone, but you're going to have the ability to unmute yourself. So we can't unmute you. So if you have something to say or we ask you to speak, you may have to unmute your microphone. But we will, if we can just do it by you muting and unmuting yourselves and keep the noise down that way, that works really great. I also want to encourage you at the bottom of your screen is the, again on PC or Mac platform, is you'll see an icon that says chat. And I want to encourage you to go ahead and click onto that. It's a convenient way to kind of exchange questions and information. Later, we're going to be taking questions from you. And honestly, in Zoom, it's just a whole lot easier if you type the questions in the chat, and then we can address that. We can certainly encourage you to speak from there, but it's good if we kind of coordinate from chat. So we're going to go ahead and try out chat real quick. What I'd love for you to do is open up the chat, and then I want you to put in your name and the organization that you're with. And we're just going to see that all scroll through as everybody gets to kind of share a little bit about, we have information from you registering, but this is just good so you can see who all is here. Look at all these names coming. Great. Wendy, Jenny, Stacy, Carla, Joey, Cheryl, it's going so fast we can't acknowledge all of you, but that's great. So we'll see all that. We're so glad that you're all here. But just go ahead and we'll keep that going. And that's going to be our main way of communicating back and forth, just because everybody popping off and talking at once doesn't work so well in Zoom. All right, great. You all are getting a handle on it. Everybody's sounding off there. That's wonderful. So what I want to do at this time is kind of jump into our agenda for the day. We are very blessed and honored to have our St. Clair County Chairman Mark Kern with us today. And I'd like to invite Mark to share a few words with us today.
Thanks, Reverend. I appreciate that. Good morning, everyone. I'm pleased today to join with all of you, the members of the Healthier Together Council, to welcome you all to today's Health Summit. I'm especially honored to be here today, or at least to be with you today, and with St. Clair County's most respected, revered, and loved radio host, Carol Daniel. Thank you, Carol, for doing this today. We appreciate that. And we sincerely appreciate the partnerships that exist between local government and our community organizations who work together every day toward the greater public good.
The paper's on here.
In 2009, our county's first health summit established a shared vision to create healthier communities. Months later, the very first National County Health Rankings report was released by the Robert Wood Johnson Foundation. And as we all remember, it showed out of 102 counties, St. Clair County was ranked 94th for health outcomes like premature deaths and preventable hospitalizations. And we were 97th for health behaviors like physical inactivity, poor diet, obesity, smoking, alcohol use, acts of violence, sexually transmitted infections, and teen pregnancy. So we knew at that point that we had a lot of work ahead of us if we were going to realize our shared vision of a healthier community. So since then, we've improved in some areas, but we still have a very long way to go. The 2020 national report shows that we still rank 94th out of 102 for health outcomes and 100 out of 102 in health behaviors. These rankings remind us every day that we need summits like this, and they're vital for the future of our communities. You know, as a public servant, I stood before you at the 2017 summit, which seems like decades ago, since everything's happened since then. But, you know, we wanted to let you know that our county's local public health system is committed to working together with other public and private health and human service partners to realize that shared vision for improved health and quality of life for all our communities. Today, despite the health challenges we're all facing as community leaders and volunteers who have committed so much to our collective efforts, I'm more confident today than ever in our ability to bring and create an even brighter and healthier future for the residents of St. Clair County. Today's Health Summit and the topics that were selected by our speakers and facilitators is all about shared leadership and accountability as we continue this journey together. The St. Clair County vision for all our communities remains one in which a creative and collaborative environment exists between health and human service professionals, business and other community leaders, elected officials, schools, churches, neighborhood associations, and special event coordinators to eliminate the cultural and economic health disparities that exist today. This was the vision we carried out into our 2017 and 2019 summit, which inspired the Healthier Together movement that you will learn more about in today's summit. Through this Healthier Together movement, I believe we can capitalize on and expand on our two greatest assets. One is to identify the healthcare problems and those contributing factors affecting our communities, and two, to mobilize private and public sectors for progress. I believe the synergy created from 2017 and 2019 summit can be recreated today and awaken the renewed sense of creativity and volunteerism among a wider sphere of community partners. Please join me in supporting the work ahead. Healthy lifestyles can increase an individual's lifespan and their quality of life. I want to thank you for your participation in this process, and I look forward to hearing how your efforts today will continue to guide those needed next steps in our journey to create healthier communities throughout St. Clair County and our Metro East communities. Thank you.
Thank you so much, Chairman Kern. Thank you for taking the time to be with us today and to be an encourager of what's going on here. I love what's going on here strictly as a citizen of the county, beyond being part of the movement itself. And just glad to see so many people here today. We do have a video that we want to share with you today. It's kind of a promotional introductory video about Healthier Together, kind of to set a foundation, because we realize that many of you may be coming on here today and thinking to yourselves, what is Healthier Together? What is this they keep talking about? You might be kind of new to that part of what's been going on, or maybe you've been around the bend for several years now, getting this thing going. And this gives you a chance to kind of celebrate a bit of where we've come from and the idea behind the Healthier Together movement that we have in our county. So I'm going to go ahead and share that video with you now, and let's get that going.
How would you describe a healthy community? When residents of St. Clair County, Illinois, were asked this question, their responses included things like public safety, access to good health care, decent jobs, parks, education, youth and senior services, housing, and transportation. That's because these things create the conditions that make good health possible. When they are missing from any community, poor health outcomes fill the gap. Unfortunately, this reality is faced by many communities in our Metro East counties, as revealed by an annual national report known as the County Health Rankings. This report shows that St. Clair County's overall health ranking is 94th out of 102 counties in the state. The report also reveals some alarming comparisons between St. Clair County and Illinois. The percentage of school-aged children in poverty is 1.4 times higher. The percentage of residents who lack access to healthy food is 1.5 times higher. Alcohol and drug-related death rates are 21% higher. The suicide rate for middle-aged men is 42% higher. The infant death rate is 50% higher. Gun-related death rates are 91% higher. Now, more than ever, we need a variety of partners committed to working together to impact the health and quality of life in our communities. That's why a collective group of hospitals, businesses, civic clubs, faith-based organizations, government, and concerned citizens formed Healthier Together. This grassroots movement, founded in 2017, is on a mission to transform the health of St. Clair County. Healthier Together's objective is to create opportunities for citizens to have a healthier quality of life. To accomplish this, Healthier Together supports activities in 6 focused areas where improvements are needed. These improvements occur in many ways and communities too. Number 1, provide support for school-aged children and their families. Number 2, bring healthier foods to those in need. Number 3, reduce overdose deaths. Number 4, reduce suicide deaths. Number 5, lower infant deaths so more babies will see their first birthday. And number 6, help residents develop safe, thriving neighborhoods. Your help is needed to continue this vital work. Now is the time to consider how you can support the Healthier Together movement on behalf of your community. A healthy community is one in which citizens, like you, and partnering organizations work together to improve our quality of life. Our families deserve better. Let's be healthier together. Visit our website to get involved today.
So hopefully for many of you, that gives you a bit of introduction. And for those of us who've been involved for a while, it gives you a bit of appreciation of the journey that we've been on. We have a lot of things that we've been able to accomplish together under the Healthier Together movement. I'm going to take a little time just to talk about that and celebrate that together today. I am going to go ahead and mute a few folks who get a little feedback on there. So what I want to do is just kind of like take us back a little bit just to remember. It was several years ago when a group of community leaders got together and started to envision what would it look like if we actually started working together. And where it all landed was, okay, we had a group of people who desired to do some good things to improve the health rankings of our community, more importantly, to improve the health of our community. And things started to get organized. And it wasn't so much that things were built from scratch, it's that we took the pieces that were already in motion, added a few others, and then got them organized and coordinated and connected together. And so as Healthier Together came on, we have these work groups that have worked together, as was featured in the video, under these different categories that are bringing together those of you who are on the front lines of these issues, who deal with them on a regular basis, because we don't need to come in and form an outside group to be prescriptive about what's needed. What we needed to do as a community was to come together and to find those who are doing the good work and then get behind them, to be another level of support, encouragement, networking, and then to bring that collective impact of what happens when we take the work that's already positive, that's already productive, and just give it that extra bit of support that perhaps it needs. And so we've been able to accomplish a lot of things, and a lot of that has been supported, motivated, made possible by some incredible financial backing that has come in. We've seen an unprecedented kind of cooperation and joint backing together for this movement between our St. Clair County Health Department and Memorial Hospital and HSHS St. Elizabeth Hospital. We have seen such great support in terms of a lot of networking and connections, but also, to be honest, in financial backing, because with the finances that we've been able to receive from those sources, we've been able to bring in folks like Mark Peters and Tiffany to be organizing factors for us as we bring these work groups together. We've been able to put together the website and a number of other resources, but we also have been able to then facilitate the encouragement and support of these work groups. And I want to go ahead and bring up some of that and share some of that with you. Let me bring up on the screen here some of what's been going on. So we convened this partnership with school districts and telecommunication industry. This is something that's just recently happened. As part of our education work group, you know, we're in the midst of this pandemic talking about what's needed. It's connectivity. While many of our schools have been able to come up with, through different grant programs, devices, Chromebooks and such for people to use, we still have kids that are experiencing a digital divide. Because even in the midst of our schools returning to the classroom, there's still a hybrid element that returning. And so we have kids out there who are not able to fully participate because their family can't afford that internet connectivity. And we don't want to see a digital divide further create issues. It creates issues when it comes to mental health. It creates issues in terms of educational advancement, in terms of graduation rates. And we really don't want to see 2020 add on to the things that are hard about this year, to be seeing our kids in our school system fall back. So we were able to convene a partnership using some of the connections that our members had with different wireless providers, and we're able to tap into a special program that originated out of Texas and that we just barely fit within the regional borders of that program. We were able to find out about it and get mobile hotspot devices that can be given to these families. And we have funding to support up to 250 of these devices for the families in our county who lack this connectivity and need it for that. And the nice thing about the mobile hotspot devices is that when that kid goes from maybe one house to another, or maybe has to go to grandma's house during the day, during
No, I'm just doing this.
you get to take that connectivity with them. So that's really key. Let's talk about some of the other things that have gone on. We've established some great community-based partnerships between local business, schools, and not-for-profits for accessing nutritious food. We've been supporting a monthly mobile food distribution sites throughout the county, which has been a collaboration of not-for-profit organizations, area churches, and and so many more. Also, we've been working with the Chronic Disease Prevention Group to implement a fresh produce voucher program where families in need can receive healthy food from participating local markets. So the idea is that we're trying to strengthen the access to food and to also at the same time stimulate our local economy. And this is soon to be expanded to the Washington Park area as well. So I hope what you're seeing in each of these examples is it's not that one person came in or one organization is coming in and saving the day. These are things that are possible because we've come together, because we're finding out the person that over here who knows a connection, and we find out that we can get funding from here, and then we found out we have access over here, and then we need a location. All this is possible because of the organizational work that we're all doing together. We've also provided support and sponsorship together. This is what we have done in terms of for 3 community health campaigns and professional training workshops. A lot of what we need to do is education to get people informed. They simply don't know of the risk factors of some behaviors. And so we've been able to put on these types of events to reduce infant mortality, decrease suicides, as well as to minimize drug-related hospitalizations and deaths. These are some of the key factors that are influencing those health rankings. And it's not just about rankings. These are some of the key factors that affect the health and well-being of our community. And we're getting out there and getting the people of our county informed so that they can be their own advocates for increasing their health quality. The last slide, just wanted to share with you is that we've helped to facilitate and fund community engagement forums, both in Washington Park and Belleville, to engage area faith leaders, school leaders, and residents in working together, building neighborhood alliances to improve the quality of life and overall health in our community. So what does that look like? What it is that when you start putting people in connection with one another, it's as if on a local level, they're able to do what we're trying to do on a countywide level. They're able to connect their resources. They're able to discover generosity that's right there at their doorstep. I sat in a meeting and listened to a school talk about the fact that they had so many kids that came in and with clothes that needed to be washed. And honestly, if they had a washer and dryer there at the school, they said that would be that would be a huge help. And then I saw a church across the room say, "We'll buy that for you." And no one was expecting that. In fact, there were a few people there who ended up getting kind of teary-eyed over this. But people don't realize that churches like mine, like many others that you'll hear about today and that you know in your own community, they're ready to help. They just don't always know what to do. So one of the things that this type of facilitation does is Healthier Together then is able to kind of point at things and say, that's where you can help. Do you really want to help? Go there. That's the thing that you could do. So these are just some of the things that are going on in terms of our partnership together. And what I'd like to do is go ahead and introduce Mark Peters. And Mark's going to carry us into the next part of our agenda. And we're going to hear a little bit more as work group members get to speak a little bit. And we're going to maybe even have a chance to dream a little bit together through your questions and our dialogue back and forth, because where Healthier Together is going is we're going wherever the need is, and we're going where we're being led by those who are in the trenches now. The whole point of this movement is that we're getting behind those who are already there and bringing more to the effort. So Mark, if you go ahead and introduce Carol and get us moving to the next part of our session.
Okay, thank you, Rob, and greetings, everybody. I didn't get a chance to say hello to all of you individually, but I'll send that across the board. Am I coming across all right, Rob?
Doing great.
Perfect. Well, I have the distinct honor of introducing a good friend to this movement and to me personally, and she needs no introduction. Carol Daniels, the KMOX news anchor. She is also an award-winning columnist, replete with numerous broadcasting honors that we just don't have time to cover, but I'll certainly invite you to see her bio on the website. Beyond that, Carol has been a great asset to this movement, even in its early years back in 2009, 2010. She is also a resident of St. Clair County. She and her husband, Patrick, are proud parents of 2 boys. And I did want to kind of make a bit of a historical transition. Carol was with us at the 2017 summit. She was the facilitator. Those of you that participated in that, they got a chance to rally several of our hospital leaders who were on that panel and our state's attorney around some of the same issues that we're continuing to wrestle with, as Chairman Kern had mentioned. I remember distinctly her final comments about that was heart-wrenching when she said, you know, my family and I were residents here too, so I want to be part of this movement. Carol, I don't want to put words in your mouth, but I think you did indicate you would be following this movement, and you've done that remarkably well. Last year, you and Dr. Farmer and Deb Humphreys helped put together a wonderful suicide prevention campaign. So we know her as the voice of St. Louis, but she is really a big part of the heart of this movement. So Carol, I'm going to go ahead and pass it on to you. She's going to lead us through a Q&A and facilitation session. So Carol, thanks for joining us.
Thank you so much. Thank you. It's good to see everybody this morning. And if it's echoey, I'm in my dining room this morning. So I hope I am coming through loud and clear. This is such a wonderful thing that we're doing. And wonderful is a word that we use often. You know, we use it to describe, oh, that was a wonderful party. You know, that's a wonderful friend. But this is deeper than that to me. The impact of this is certainly about lives and souls. And so when Dr. Farmer first approached me many years ago, and by full disclosure, Dr. Farmer was our family doctor and is a friend. I call him Dr. Farmer, and he always corrects me and says it's just Bob. But I'm like, no, you're Dr. Farmer to me. And so when he first approached me, there wasn't much that I would say no to, because anything that he was involved in, I knew was something that was valuable. And this is incredibly valuable. Mark and I got to know each other just through my job as a journalist. And so he too has become a friend. And isn't that what is happening here? We are all becoming friends in this effort to help our friends, to help the community. And so I have a few questions, and then another full disclosure, I have to leave early. Speaking of health outcomes, both my parents they're better now, but they were ill, and we have since moved them from Fort Leonard Wood, Missouri, from that area where my father retired after 27 years in the Army, to Colonnade in O'Fallon, Illinois. And we are beyond grateful that we have such an incredible facility in our community, 10 minutes from my house where I live right now, in Colonnade. And so he's getting an honor, a quilt of valor this morning. And so that ceremony is going to eat into my time. So I have to leave you early, but I will be aware of everything else that is going on. So let me start with some, to bring us up to speed, if you will. And I think that a group like this needs to hear even more. Let me hold a mirror up to you about what you have done, because it's going to give us the energy for the next journey, because surely the pandemic has done a number on all of us in a variety of ways. And so I just want to give an opportunity for a certain number of people and then open it up as well. So let me start with my friend, Bob, Dr. Farmer, and then we'll go to Mark as well. Bob, can you weigh in on what you think we have already accomplished with Healthier Together? And then Mark, the same question for you. What have we accomplished? Because those numbers are still striking when you hear them. 94th out of this and 97th out of that. So Bob, can you start, and then Mark join in there? What have we accomplished?
Sure, thanks, Carol. And Carol, thanks for your, number one, the kind words, and thanks for your voice and your passion to help our community, because you get asked to do an awful lot of things because of your your role in our area, and we greatly appreciate you lending your voice and passion to this. That's wonderful, and we greatly appreciate it. I think I want to thank everybody for being on the call, in the Zoom call this morning. I think the thing that that I'm probably the most proud of that we've accomplished is, we set about trying to get a grassroots community movement to support a lot of people who were already doing a lot of great work in our community, the kind of unsung heroes behind the scenes. Day by day, every day, these people in our community are trying to help others. And I think by trying a collective impact approach that kind of came together out of the prior get-togethers that we had with the county health, in mind, I think that what we found is the folks that are doing a lot of the hard work every single day just needed maybe a little bit more support behind them. And that's where the whole idea of collective impact that's done in other communities across this country came together. And, you mentioned it. I think it's people working together to help other people, and it makes us all stronger and better. And I think while it's taken a little bit of time to really formalize and get off the ground and get moving, I think we're at a place where we're really doing that now, and we're starting to see the fruits of that labor. And so I'm very proud and very hopeful and very optimistic about where we go from here, because a lot of people have come to the table to support the people that are in the trenches every day trying to help others. And I think we're in a good place.
Mark, the same question to you, and because I think that the nitty-gritty of this is that we have enabled a child to come to school with clean clothes, as we heard from Dyer, that we have enabled a mother to deliver a child healthy and that child see its first birthday. I mean, that's the bottom line of what we are seeing. This organization has come together and in some way, shape, or form, and through its collective efforts, has stopped someone from taking their own life. Mark, go ahead.
Yeah, I think what I have observed over the last 10, 15, even 20 years here in St. Clair County is just an ever increasing awareness that this problem doesn't belong to any one organization. It doesn't even belong to the healthcare sector. It really is something we are learning to own together, and to also try to focus on solutions, as Rob said. They're the day-to-day interactions. So that would be one takeaway. For back since 1994, the health department, both the St. Clair County Health Department, Eastside Health District, and later on our hospitals would be mandated to do a similar an assessment and a planning process. And those were always built on 5-year increments. What we've come to learn since 1994 is those problems take a lot longer than 5 years to address. We are focusing on the things that lead to poor health, and it's not just the quality of our healthcare, which is second to none in this county, but it is a lot of the underlying issues. So we are working with organizations like the United Way and our churches and our school systems. I think people understand that they're in it for the long haul. This is something, that is going to be with us for a long time. The solutions need to be taken, at face value, but also expanded to neighborhoods and to schools and to the business community. And I think the 103 people that I just counted that are on this call are getting that. And that's a beautiful thing to see that happen.
Thank you so much. May I call you Robert? I feel bad if I do, but Reverend Dyer.
Yeah, Rob's good.
Yeah, it's Rob. Okay. You get the esoteric question, my friend, because the tagline of the organization has the word hope in it, and that just touches my heart, because I feel that people who have hope may not even realize it, but people who don't have it, definitely, we can see the outcomes of hopelessness. How do we get in there? How are we with this organization, this collective of powerful people, really getting in there and telling people there is hope, and I'm representative of that?
that's a great question, because I think that what we accidentally fall into is optimism instead of hope. And I'm all right with optimism, but optimism is that belief that I don't know how, but some way this is all going to go good. and hope is when you see a path. Hope is when you have something to lift yourself up on, and then to reach for something. You know, someone much wiser than me said to me that, you know, when you're falling, it's very hard to have hope. And that's so true. And so I really see that what we're doing is we're providing footholds, or we're providing, you know, a support system such that when someone says, well, I want to get better, I want access to this resource, or I'm a person out in the field and I'm trying to make a difference, that there's that when they look around and say, I can't find the support I need, here we are. And you know, if you've got that, if your group has that idea that's going to make the difference, then we can be there with hope, because we can be part of providing that path to actually accomplishing what you're looking for. The phrase we used to, in the early stages, we used to talk about the show Shark Tank. I don't know if you're familiar with this, you know, it's like people have really great ideas. They go in, and then people who have the resources, the connections, the money, just the know-how are there. And if they believe in that, then they support that. And we said, well, we don't really want to run a shark tank. That sounds intimidating. So we like to say we run a dolphin tank. It's more friendly, but it has the same notion that these work groups come to Healthier Together. And when they have not been able to find that support in other places, here comes a path of hope. So yeah, I'm a big proponent of hope. It's a part of my job, part of my calling, and I believe it's part of what it means to be an encourager in our community, which is what Healthier Together is all about.
Thank you so much. And Pastor Rogers, are you there somewhere? I can't see the whole, because I have it in speaker view, as I was told.
Yes,
Pastor Rogers, there you are, sir. Thank you so much. I won't give you the esoteric hope question, but because I'm an active member of my church, I have my husband and I and our grown men. Somebody mentioned I have two boys. I have two men in my life. They are 20 and 24. But talk to me about what the church has accomplished and why you even got involved in this in the first place.
Yeah, well, obviously, my passion is to be engaged in the community. If the church is a part of the community, you know, that we have a real opportunity to help lift that community. We are the salt of the earth. And so I got involved primarily because of some initial engagements with the work group, and looking at the needs from a community safety standpoint. You know, there was a lot of contributing factors that we looked at: education, public policy, environment, unemployment, etc. And obviously, we are there to help lift that community. So I got involved because the need is great, and we are on the ground, and especially in the area which we serve in the Washington Park area, is one of the most challenged areas in the Metro East. And we were having to actually get out and go door to door, because the people don't have, as Reverend Dyer talked about earlier, about the digital divide or technology divide, don't even have access to the internet. So a grassroots campaign is necessary. So we were right there at ground zero, and some of the other groups that have looked at some of the metrics in our area with regard to crime, we are one of the hot spots. So I believe that we have a social mandate to be involved. I don't have to do it. Obviously, my wife and I, who came back to this area about 3 years ago from Ohio, we were originally here back in the early 80s to about 2000. And we lived on the outside of the outer belt. But because of a call to duty, we came back. And now we find ourselves entrenched in what is going on in that community. So I have a passion. We have a passion. Our church is motivated. And we are working now with faith and business leaders to build some collaboration, as Reverend Dreyer talked about the collective impact. I think it was Dr. Farmer talked about collective impact, and all of us working together in our various areas of expertise or with the resources that we have are trying to bring about the changes that are needed in that community.
Pastor Rogers, I want to stay with you for a second. One of the most difficult challenges, and I guess I'm being very personal when I say that, but other people may have different challenges and clearly do, for our community of descendants of slaves, to be frank, is the sense that a lot of us have that we battle through, that we are not even worth the battle. That many in St. Clair County are where they are because that's where they deserve to be. And they can't even see that, oh, I could never live on the hill. I could never live wherever because that's not where I belong. When we talk about healthier together, far too many don't even feel they're not a part of the together, the good together. They're part of the bad together. If that makes any grammatical sense there. How are you battling and peeling back those generational layers of unworthiness, of trauma? Go ahead, sir.
Yeah, I mean, that's a great question because it's a faceted issue. And obviously we have to deal with the psyche of people who have gone through generations of being sort of left out, so to speak, and being disenfranchised. And so it's not been easy because there's a lot of cynicism in that community because there's been a lot of broken promises, a lot of things that have not come into fruition. So I've had to personally, in working with some of the area leaders, I know Pastor Pettiford is on here as well, to help build that trust and allow or to help build a sense of community there so that people realize, hey, even if we can't live on the hill, what about building our own community? If we can't get services to come in, how about we create those within ourselves? So, Healthier Together has been a great partner through this pandemic, and even before, probably last December, we did a major food distribution, over 30,000 pounds of groceries. We've done mobile food marts in collaboration with the St. Louis Food Bank. And then even this November, we're going to be doing a similar effort to just engage people and get them to know each other, to develop a sense of pride in the community and say, what can we do? And I've talked to Mark in the past, and I told him, I said, based on the best practices that we were given initially by the Sheriff's Department, the best community safety efforts are around community engagement and getting the neighbors to know one another. So that's been a big part of it, is just to get them involved and get them engaged. And so we've done a number of things in regard to having community impact forums. We did a voter registration drive here recently, and we've partnered with some of the other area businesses like Ameren has been a big partner and collaborate with us as well. So you're right. I mean, we are having to work in multiple areas. And when we talk about the environment, that area, as you probably know, has got a lot of derelict housing. So we work with the county in trying to get some of those houses demolished and create green space. We work with some of the other work groups as far as bringing food and bringing awareness. We've actually partnered with them with some of the events to bring their information to the community, but it's not going to be, as Mark said, just a one-time effort or a one-year effort. There's a strategic long-term plan to try to redevelop the sense of community and bring people back in. And the other thing is to bring businesses into the area as well.
One last question for and this will be for Chairman Kern, if he is still with us. You lead a county that has such sad, shocking health outcomes. And I know that for a person such as yourself, and we've known each other a very long time, that one of the goals is obviously everybody wants to bring in business. Everybody wants to, a new hospital, build a new high school, roads, There are so many, new housing projects that are going up. So economic development is often seen as the path to success in a county. But I wonder if you could talk about your leadership of a county that just isn't healthy, that doesn't see itself, that doesn't eat right, that isn't, even though you go to Edwardsville and everybody's on a bike, and I probably have neighbors that are running by my house right now. A lot of people walk, which is great. But talk to us about that, Chairman Kern, and what your next steps are to not only lead a county that is successful, that has good jobs, but to lead a county that is just simply healthy. What are the next steps that you take from your perch, if you will, Chairman Kern?
So it's organizations like this, getting them together to be able to kind of lead. Although the county certainly is in a leadership role, we share that leadership with a lot of other organizations. So when we talk about economic development, the main purpose of economic development is to try to create the kind of revenue and jobs that's going to take to solve a lot of these initiatives. Some things can be done with relatively small amounts of dollars and really large amounts of work. When you talk about cleaning up communities, largely that's a volunteer effort that is supported by the county. Through our efforts with Clean Sweep, we pull out millions of pounds of trash out of all our communities every year. We're in the targeted areas that we're talking about every day with workers who are trying to clean up the neighborhoods to not only give a better sense of a quality of life, but to let people know that we care. And when I heard your poignant words earlier, we want everyone in St. Clair County to know that somebody cares about them. So whether it's through Healthier Together, whether it's through our health department, whether it's through our mental health operations, the St. Clair County Mental Health and Dana Rosenzweig, we all work together to try to get to the heart of the problems. When I see those numbers, it's extremely disconcerting. We're trying. We spend millions of dollars to build bike trails, but then we got to get people to use them, and many people don't have bikes to even get on the trails. So these problems are generational. These problems, many of them, none are insurmountable, but many are certainly going to require a lot of effort and a lot of collaboration to be able to solve. I mean, it's just such a large issue that we're dealing with that there is no silver bullet. It's just a lot of smaller things that are going to come together to make that difference. This pandemic has really caused a lot of us to focus on the health issues, a lot of things that we thought we had covered in the community that we really don't. Right now we're searching for a building to be able to give the vaccinations whenever they come, and also to be able to test people for this coronavirus during cold weather months. You would think that would have been something that would have been readily available, that we would have had on hand, that we could find. And it's been fairly difficult to find a spot where everyone can get to, everyone can access with public transportation, another piece to this puzzle. So it's really brought a laser focus on how we're really trying to get through this. And beyond that, with Healthier Together, you're focusing on a lot of the underlying health conditions. When we hear that word, or that phrase that we never really heard about before the pandemic, underlying conditions are things that you're trying to solve, like diabetes and hypertension, all these problems in our community that really lead to a higher death rate because of COVID-19, because those issues remain unsolved. And although we're getting better, and I appreciate everything that's going on here, and certainly the hard work of the health departments, Eastside Health District, we got a long way to go if we're gonna get where we need to be. But that's why a summit like this is important, to identify the need, talk about some solutions, and just get it done incrementally. That's the only way we're going to solve all this.
Thank you so much, Chairman Kern, and my news spidey senses were going off. I'll be calling you later because there's a story there as you search for that building to give the vaccinations when they do come. I've keyed in on that phrase. Thank you very much. I want to read a quote that Linda put in the comments, Linda Schultz, a great quote by Peter Kuzmak. Hope is the ability to hear the music of the future. Faith is the courage to dance to it today. I can hear the music of the future, and I'm always ready to dance. I am always ready to dance. I'm going to leave you now, but I want to the first person that I spoke to, go back to Bob, go back to Dr. Farmer. And before I leave, what would, Dr. Farmer, the marching orders be for us next? You're the person who got me involved here, so I'm going to ask you that question. And everybody, obviously, everyone on this call today is active and involved. You know, that phrase comes to mind, preaching to the choir. This is the choir, right? And so, Bob, what are our marching orders in the midst of a pandemic? Some say it's rounding the corner, others say clearly it is not. We thought this thing would be over by May. Some of us, not the case at all. In the midst of that, what are the marching orders as we move forward and look at 2021? Bob?
Probably I'm going to call it the marching request. I hate ordering people to do things. So I see there's 104 participants on this call. And so I think just as many of us have picked up the phone and called our friends and family and said, you know, we're doing something worthwhile to try to help a lot of people who have already been doing things that are very worthwhile. Can you help us in this endeavor? I think that is the request. You know, we just need more people to know about this and to know of all the good work that's going on. And we need a lot of people to bring their friends and resources and contacts, because this is just one big collective impact. It's one person helping another who helps another, and pretty soon you get a momentum and the dominoes start to fall in a positive way. And I think it's letting others know what we're doing. And because despite us doing this for the last couple of years, at least in a formal way, that, you know, forming this organization called Healthier Together, which is, you know, now a not-for-profit registered with the state, you know, as a way that we can, you know, now accept funds from private and public folks that want to help us when we have, you know, some of this stuff costs money to, you know, to help get the kids connected that didn't have internet access, which is a big win. I think, you know, the thing now is I've kind of sometimes felt like we were treading water when we started this over the last couple of years. I kind of get a little impatient with myself and with what we're trying to do. And I use the, excuse me, I used the analogy the other day that sometimes when you're treading water, that's okay. It gets a little impatient, but sometimes you're at the mercy of the currents, and sometimes the currents take you out to sea, never to be heard from again. And other times you get lucky and those currents take you and wash you up on a deserted, beautiful tropical paradise that you can plant your new resort and invite people to and say, come enjoy the beauty that we found here. So I prefer to think that we've been washed up on a shore, and now we're starting to build that resort that we're inviting all of our friends and family to. And so that's what I'm hoping to find, is that we get truly a collective impact, community members across demographics and across disciplines together to join us. We've got so many wonderful people that are already doing all the hard work, and more people every day seem to be joining us. But I think the marching request is, please ask others and tell others about what it is we're doing, because everybody has different contacts and different talents, and who knows where those will all come together in the puzzle, but I'm sure they will.
Thank you so much. I'm going to go to my father's ceremony, and I thank you all. I'm okay giving orders because I'm a mother, and so I am going to give orders. Bob, I appreciate you. I appreciate the request. Mine is a mind shift, and obviously, again, this is the choir, but I want us to. I would ask that you, and this is an ask, that you shift into a boldness that you never had before, because that is absolutely needed. We have to think about the impossible and know that it is possible. That Washington Park can look a different way and the people can feel a different way about it. that just because you live in O'Fallon, as I did, I live in Caseyville now, but just because you live in O'Fallon and you think it's a fantastic community, peel back the surface and there's domestic violence and suicide and obesity and the like. And so we have to shift into a bold way of thinking about who we think we are. If you think you are someone who, you know, life is all together for you and you don't realize that it's not together for others, then you have already missed the mark. We have to shift into a bold way of thinking. And that boldness for me is thinking outside of myself. I always have as a Black woman. I've always thought outside of myself, being married to a Black man and giving birth to 2 Black sons. I've always had to think outside myself because the world never was going to think about my men as something that was worthy of saving and something that was worthy of protecting. So I've always had to be bold and think outside myself. And so I don't want to be involved in anything that just thinks that it's gonna work on anything that just looks like itself. I don't want to be involved in anything that is just going to save what could already save itself. We have got to dig deep and to save those who really don't even think they need saving, who are out to not only harm themselves, but take everybody else down with them. And so that's my not only request, but my demand that we be bold in St. Clair County. We can no longer accept that we are in the 90s out of the counties in the state. And I know this organization is together because we don't accept it. But let's move in a bold way going forward. This pandemic shook us all, and it ought to change the way we operate. It ought to change the way we think. It ought to change the way we speak. It ought to change the way we believe and what we believe. And so if I'm going to stay involved, we're going to be bold. We're going to be bold about it. And I am committed to that. Bob's going to call me 2 days from now, and he's going to say, "You said bold, Carol, I got an idea." Because that's the way Bob thinks. And I appreciate that. I really do. So let us be bold. Let's be bold. I appreciate each and every one of you. Thank you, Mark. Thank you, Bob. Thank you, Chairman Kern. Thank you so much for inviting me to be a part of this. I want my community to be a great place to live, and it can be that. You all have a great day. Take care.
All right. Thank you, Carol. All right. I'm going to ask for an amen from all of our ministers out there. And by the way, Carol, you said bold. I counted maybe 20 times, so good for you. Thanks. Rob, I'm going to go ahead and ask if you could let me share the screen, and then I'll kind of segue into the next session. And congratulations again, Carol, to your father for the honor that he's going to be receiving. So for our next section, I wanted to chat a little bit about some of those areas where we are intentionally going to try to be bold. And I'll just share with everybody our website, because this is really where some of our great stories are coming and rising to the surface. We have a number of unsung heroes, our members of the council, some of our volunteers, the work group leaders themselves, as Rob and Bob have said. We're not creating anything new. We're trying to bring together, resources that can aid these efforts. So for the last year, during which time we've invested the contributions from our what we call our angel investors, and we have a couple local foundations that have invested as well. We spent a good deal of time putting a plan together, developing a platform. So what you're seeing here is the website. We also created an opportunity for our work groups to come to us with that dolphin tank concept, and if they needed resources, we want to keep it as unencumbered, as simple as possible, but we've been growing in this experience as well. And we refer to that as our mini grant. Several local foundations that do this, so we wanted to join with that and let our work groups and coalitions and alliances know that if they needed something, they can come to us and ask. So we have a review team of about 6 members. And I'd be remiss if I didn't mention the United Way. The first year, United Way gave us tremendous support as a lead fiscal agent that helped us coordinate and administer the funding that needed to go out until we could become a legitimate non-for-profit. So again, thank you for all the the shepherding and stewarding support that we received in year one from the United Way. What I wanted to kind of introduce is just a way for any of you out there that are part of existing alliances, coalitions, work groups, clubs. We have 6 strategic focus areas. So when you look at our homepage, you'll see those mentioned down here. Every one of those strategic focus areas, we have been able to identify through the course of this project an existing alliance in the county. And we've been able to say, look, we have some funding set aside for you to do what you do best. We are now kind of opening this up in year 2 as we continue to raise additional support. We would like other alliances to join with the existing ones, or if there are new ones. So what we've wound up doing is creating an opportunity for those alliances to tell us who they are. And this is a fairly new part of the website, so it's still under development. And I'll use our chronic disease strategic focus area and an alliance known as Make Health Happen. This is just an example of the number of organizations that are part of this. We would like to set aside additional funding support for the work that these alliances do. We also, in just a moment, I'll segue back to Dr. Farmer and to Pastor Rogers to talk a little bit about some of our targeted approaches in year 2. But in 2021, we do want to open up additional funding applications. And the way in which we want to do that is we need to know who's out there. So we are asking each of our current alliance members to come into the focus area page here. If you're a fairly new alliance or one that we just don't know about and you fit under one of these categories, there's an opportunity for you to kind of tell us a little bit about yourself. It's a very short form that our web designer created, so we know how to reach you. So what we're asking is, in the next couple months or throughout the year, if you want to join this movement, this would be the best way. It doesn't obligate you for anything. We just want to know who you are and how we can contact you so that as funding becomes available, we can reach out to you and share this application process, which will be an online application process. And of course, there'll be more questions about that in the new year. Everything's going to be dependent upon the financial capacity we have, and we're currently in a fundraising campaign. So your support towards that end will also go a long way towards making sure more homes have access to the internet or more tables have nutritious food. So that was just a plug we wanted to mention. And if you're out there and you're already one of these work groups, make sure you're represented in here. If you're fairly new, if you are a neighborhood association or a local club, this is really to encourage alliances working together. And on that, I'll kind of pause and transition to the number of stories. This is how we communicate all the good work that you are doing. So anytime we're able to support with real dollars or even volunteer time, we have a great work group coordinator, Tiffany, that works with the work groups to capture the information, and we try to put that onto the website. So we would love to see this page do nothing but grow with more and more success stories. And with that, I think I'll transition over to you, Dr. Farmer and Pastor Rogers, to talk a little bit about some of the targeted activities. I think you referred to that, Bob, as treading water, but I think it's time to kind of share what's happening in Washington Park, what could be happening, and also in communities close to Belleville and East St. Louis as well. So Bob, go ahead.
Thanks, Mark. So what we have tried to do when we got together a few years ago to embark on this journey, one of the things we did is we looked to other places that have done this and done it well. And just up the road in Springfield, Illinois, where the SIU School of Medicine sits, Dr. Jerry Cruz and his population health team have done a project called the Enos Park Project. They started it several years ago, a 10 square block area, about 2,000 residents, kind of bookended between the two big hospitals up in Springfield, St. John's and Memorial. And what they did was they did a collective impact community group approach, much like we are doing. to try to get all folks at the table, from schools to clergy to public safety to the EMS, the sheriffs, the hospitals, everybody, is anybody who had an interest, which is basically everybody in the community. They got them all together and they said, how do we, let's start in this area and see if we can make a difference. And they did. And they've won national awards from in the medical arena for doing population health and actually changing outcomes. And outcomes they look at is, how can you keep people out of the hospital? How can you reduce emergency room visits? How can you do better telehealth? How can you do things better at home to keep people in their own environment and get them the support they need? So we asked Dr. Jerry Cruz, the dean of the medical school, to give us some ideas, and he came down to talk to us about that. And to the treading water thing, we have been treading water in the sense that we were waiting for some data. We were waiting for the right time, strike when the iron is hot type thing. And I think we're finally positioned that, and I just talked to Dr. Cruz last week again, and given the COVID arena that we're in, there's a lot of federal funding that is available to support community benefit projects, just like what we're talking about. And what we're trying to do is we're going to try to replicate the Enos Park project in some of the areas of our county, which the data drives us to. And anecdotally, we all thought that, well, when we look at the economically, socioeconomically challenged areas like Washington Park and East St. Louis, it seemed obvious to a lot of us, this is the place where we can maybe do some good with a lot of other people who are already trying to do some good. And we looked at places in Belleville and we looked at places in Washington Park, and sure enough, when we got some data that talked about some health metrics, it said, yes, these are the zip codes that are struggling the most and need the most help. So with that in mind, we have re-engaged the School of Medicine after kind of sitting on the sideline a little bit, and Dr. Cruz has given us his commitment that they're going to try to help us through population health and through helping us learn from what they did, both the successes and the mistakes they made along the way, to help guide us through this this endeavor that we're going to go on. So we're positioned in a place where we can start to try to replicate that, and we're going to focus in one area in Washington Park. And a key person that's already helping us and who's helped rallying the troops and kind of getting the community grassroots approach going is Pastor Rogers. And he gave Mark and I went down and we kind of got reacquainted with the community. Quite frankly, it's a place I drive by on the interstate a lot, and I think a lot of us do, and we don't necessarily stop to see what's going on in the lives of others. And so Pastor Rogers graciously took us on a tour of the community to show us some of the challenges. And there's a lot of opportunity for people to help themselves and for others to help them help themselves. And I'm going to turn it over to Pastor Rogers. You've already mentioned a lot of what you're doing, but if you just want to follow up and anything else you want to tell us, Pastor Rogers, about as we embark on this, what you need and where you see it going.
Yeah, Dr. Farmer, I appreciate it, and certainly thank you and all the members of the Healthier Together who have helped us do what we've been trying to do for a number of years. And part of my outreach to some of the other faith leaders is that we have not been in the past been given the resources to be able to do what we are trying to do, what we've been mandated to do from a biblical standpoint. And we are challenged to find resources to be able to help the community in which we serve. And unlike some of the our sister churches in the suburban areas, many of our constituents come with a handout looking to see what we can do. So we're challenged. And so we're trying to build a network, not only of individual leaders in both the faith and business community, but also organizations, so that we can grow this. And our primary point is to say that we can do more together. So building a network of leaders, a network of community advocates that are doing great work in our area, but a lot of them don't even know that the other exists. And there's a lot of competing priorities and a lot of overlap. So just to try to get organized and find out who's doing what, and to see how we can work together to form that collective impact is what we're doing. So, we've reached out to organizations like United Congregations in the Metro East, The Visiting Nurses Association, has reached out to us to help disseminate information in that community. And one of the biggest challenges that we have, and especially now during this pandemic, is that it's difficult to reach people from a cyber standpoint. So Facebook and other forms of social media are not really at our disposal for a large part of that community because they're underserved. And so, when we look at the different focus areas, it's not just a silver bullet. I think as Chairman Kern said, there's not a panacea to resolve all the issues. So there's different focus areas. And so we're asking each one of those leaders to look at a particular area that may be a passion for them. So in the case, and I believe, again, Pastor Pettiford's on here, he's very involved in community engagement. Pastor Stallworth is involved in beautification projects. And I know he's been working with other organizations like R3, the Lansdowne Corporation, to help clean up some of the derelict housing and some of the alleyways. And so I think Carol hit on it, a little bit about the fact that these are communities that have had generations of people who've come through there. So there's a mindset that we have to deal with as well. I talked to one of the representatives and they did a neighborhood cleanup and they said, but then the next 2 or 3 days, it looked like they hadn't been there. And so one of the areas that we know is home ownership. How can we lift people, because 75% of the people that are in that area are renters. So do they have skin in the game? Is there a program for that? So when we look at education, public policy, environmentals, unemployment, mental health, all of those are contributing factors, not to mention that the fact that we're in a food desert. And so getting proper nutrition there, and just the derelict housing, number one, gives a launching point for a lot of nefarious activities. So health and safety in that area are big factors. So again, we appreciate the help. And again, I'm looking to the leaders and the community residents to say, what can we do? What is the plan that we have? And then ask others like Healthier Together and its partners to say, yeah, we can align with that strategically and help you help yourself. And so that's my thing. I want to build an organization that is sustaining, that can move forward beyond this time and season, into the future. So.
This is Katrina Galati with University of Illinois Extension, and I just quickly wanted to add to what Bob and Pastor Rogers have stated just now. The Chronic Disease Work Group has implemented a food voucher program, like was mentioned, Mark mentioned it earlier, in Belleville, and we are now getting ready to implement that in Washington Park and East St. Louis with Neighbors Market and other partners in that area. So it was a very successful food voucher program in Belleville. The redemption rate was about 60% over our high months that we had people going to the stores we were partnering with and using those vouchers. And so we're implementing that now in Washington Park starting November 1st, hopefully, to move forward and hopefully have that same impact to address the food access issue in the St. Clair County area. And so with that, we are partnering with Make Health Happen, which is another partner coalition that we work with as well.
Thanks, Katrina.
Yeah, I will say to that, Mark, also, and we certainly appreciate that, we need to have food resources there. I know one of the work groups has been working with trying to get more healthy food sources, because we have more packaged liquor stores than we do grocery stores in that particular area. And so, when you talk about bringing in, a major food produce place or a retail location, the infrastructure has to be there as well. And so when you peel back the onion, there's so many layers that have to be dealt with, and so many focus areas, because the internet is one, of course, and then you're talking about just simple infrastructure. So how could we bring someone into the area or even start something there locally that can hopefully grow. So these are the ideas that we're talking about. I know R3 is involved in helping to educate young people in the trades. So if we can get tradespeople to come into the area, then can we train people that say can be plumbers and carpenters, you know, for the next round of workforce and labor. So.
Pastor Rogers, this is LaQuisha Hayes with the University of Illinois Extension. Katrina, the one who just spoke, that's my coworker. We are the chronic disease work group. And I am also a member of Make Health Happen. And a part of that initiative in regards to increasing access to healthy fruits and vegetables in the greater East St. Louis area, we have been working on what you were mentioning about the liquor store ordinances with us having more corner stores in that food desert area than actually having the grocery stores present. So with the voucher program that Katrina was mentioning, implementing in Washington Park, the chronic disease work group did take that into consideration. So Neighbors Market does not sell alcohol. So we're happy to say that. So that's just adding to what's already been established. So I'm very happy to hear about the safety work in addition to the food access work that you have mentioned. And I look forward to trying to connect with you later after this. But yeah, this is an awesome opportunity to show that layering and saturation in that area, because Washington Park, that is what I'm a product of Washington Park. So it's hitting home for me. So just seeing like people coming, actually rallying together to try to improve this, because Washington Park gets put to the side a lot of the times. You have East St. Louis with all these food pantries, all of these different things being put together in efforts to improve that. But people forget Washington Park, that city, East St. Louis is the school district. Our kids are there. So happy to continue this effort with you.
Thank you so much. Let me just say this too, Mark, I don't want to monopolize this, but also November the 20th, this is just a shameless plug, but it's not for me, that we're going to do another big food distribution. So that'll be out on the media as well, the 20th of November. So we're looking for similar resources. So again, last year we did 30,000 pounds. We're looking for similar resources through the food bank. So any volunteers that we can get to help during that time frame, we would love. So mark your calendar, save the date. Thank you.
Thank you, Pastor Rogers. It's probably a good time to mention that if there are any events you would like us to post, we do have a community calendar, and Tiffany's been very good about doing that. And Pastor Pettiford, I'm sorry if I interrupted you there. So
no, you just about said it. I know we put our letting you know that just that the month is really getting packed with us trying to hit Washington Park. As Pastor Rogers was saying, all of us doing a little bit makes it a little bit more manageable. He got that big hit at the end of the month. On the 5th and the 19th, we got 2 more food drives going at 9 o'clock at the church, at another church at the community center. So our efforts and working with Pastor Rogers and working with Healthier Together allows us to, because one thing they want to do is they like, well, when is the next one? And when is the next one? And when is the next one? So us trying to turn around and do that, we're trying to have enough efforts and events going that they can at least see something going on. And I love the idea about letting them look at the community center, because even though it can't happen at a daily time and it almost can't happen at a weekly time, but with each one of us hitting the calendar and making things available, we are doing the COVID shots, COVID testing and other things too. At the same time, they at least every week can turn around and see something going on and see some kind of effort and can hit it a different week.
Yes.
So you said it on the community calendar. We're going to keep that updated and put those things on there. And again, it's another effort. We're working together, and under Pastor Rogers, we're really trying to turn around and hit this city as much as we can, as many times as we can, in any kind of direction that we can turn around and do it. All right, sorry to disturb you.
no, it's wonderful. Thank you. Thanks for sharing.
Yeah, that was fantastic. And I think that bringing together all these voices to inform one another of the great things that are happening is just another one of the great things we have going on with Healthier Together. We are nearing the end of our time today, and I would love to release you at least 3 minutes early so that we can claim we got you out of here early. And that usually makes us liked a bit more in this universe when you let people out early. But I just want to remind everyone that there are many opportunities for us to jump in and be bold, as we've been encouraged to be today. And if you go to the Healthier Together website, if you go there and look at the work that's going on and connect with Mark and to get connected with those work groups, we want to be in a position where we have to say, I'm sorry, we've run out of resources to help you. And I'm telling you, we haven't hit that. So a lot of times people say, oh, we have nothing to help you with. Sorry. Like, actually, I'm here to tell you that Healthier Together has resources to help these work groups take the next step they need. What we need are applications coming from the work groups. And what it takes for that to happen is it takes you all to be involved with the work groups, because they need volunteers, they need organizers, they need people who can give a couple of hours here and there to move that work group forward, because we cannot ask the same 12 people to bear the burden of all this work. We have to share the load, as we talked about today. And so I'm going to invite you all out there to be bold enough to take a chunk of your time, a chunk of your heart, and put it towards these work groups and help develop ideas and solutions that we can get behind. Because I would love to be at the point that says, we've gathered all the resources we could find and we've handed them all out to the community. I'm sorry, we're out. I would love to see that day happen, and we haven't quite hit it yet. So let's get going. Let's do this. So we're going to go ahead and close our time together. I want to say thank you to Carol Daniel. I want to say thank you to Chairman Kern. I want to say thank you to my friends, Pastor Rogers and Bob and Mark and everyone else who jumped in, was a part of this today. I'm grateful for the friendships that this is building in our community, and I'm grateful for the hope that this makes real. So I hope all of you have a wonderful day. We will have a recording of this that you'll be able to share with others, that you'll have access to just through, again, the Healthier Together website. And please jump in, be bold, get involved. And I hope that this has been a blessing to you. I hope this has been a time when you've been informed and maybe a little bit inspired. And most of all, I hope you got a really good nudge into something that maybe you could be a part of. So thank you all for being here today, and enjoy the 3 minutes we just handed back to you. Peace be with you.
Thanks,
Bye,
Rob.
everybody.
Thanks, Rob. Thanks, all.
Thanks, everyone.
Thank you, everyone. Stay safe.
Thanks. Bye, all.